So next up, we will have the Department of Agriculture and Trade and Consumer Protection camp licensing. So for many of you, if you are a licensed camp in the state of Wisconsin, this is your licensing entity. And Stephanie will be talking about some of the observations they're seeing during this time and kind of some of the new expectations that might be coming out. Now, keep in mind that the licensing board license residential programs. So our commuter programs do not fall under that category. So just keep that in mind too, but it does not mean that if you're a commuter program that you should not absorb some of these best practices in order to do your programming safely.
Okay, so you can see the objective there on the screen. So my role at the Department of Agriculture, Trade, and Consumer Protection is, along with many local health departments, is the licensing and inspection of recreational education camps statewide. And that includes the overnight stays. If there are day camps or day programs, they are regulated by the Wisconsin Department of Children and Families. So that is one distinction to note before I really get started into this session. So again, this is how Pernisha kind of invited me into your group with this main objective in mind. And so the department has received several frequently asked questions related to camp operations and COVID-19 over the last 11 months or 10 months. And I'd like to share those along with what the current rule ATCP 78 has interconnected that would support your operation with COVID. And so also there are many resources when it comes to helping your campus camp decide how your planning and preparations will go. So we'll cover that today. And last but not least, beyond COVID-19, back to kind of day-to-day operations, I wanted to give you a status update because our rule is currently open for revision and it is underway of being updated. So let's explore how COVID-19 has impacted our camp here in Wisconsin. At the start of March 2020, there were 231 total licensed rec ed camps. And what we did was take a snapshot of that 200 and looked at 53 of those camps as a snapshot. We offered, and as you can see by the chart, 64% did offer some type of camp, but that is grouped together, including day camps, family camps, virtual camps, and face-to-face camps. So I think it's a little hard to tease out just the face-to-face camp setting. Another data point we looked at was the 2021 license renewals, and that was extended out to the beginning of January. And even as of last week, we only had one camp go out of business. So I think with that information provided, it kind of leads us to be cautiously optimistic for 2021. So let's look at some rule specific, what the law says about rec ed camps and looking ahead with COVID in mind. This policy, what was in bold, was shared back in 2020 to all the licensed camps. And this is including some of the health certifications, lifeguarding, first aid, CPR. And with this in mind, we also are revisiting this practice. We are considering a requirement for health staff and lifeguards to complete whatever review course or review options are available from their vendor. Because we know just from looking at American Red Cross or American Heart Association as some of the common vendors, they really aren't up to full capacity to offer those face-to-face courses quite yet. There's some blended models and some different things going on around the state, but we did want to keep this renewed.
Are you all able to hear her, or did it cut out?
It looks like she has.
She froze.
And that would include COVID-19 vaccination history.
Stephanie, we just lost you.
Also thinking about the approved vaccinations, right? Currently on the market are only approved for ages 16 and over. This information supports the need for these multiple mitigation strategies. And I will talk more about that in slides to come.
Stephanie, just so you know, you cut out there for a minute, so but I'm sure we'll catch it up in the upcoming slides.
Yep. Also required in 7819 is written procedures and space for the temporary isolation of sick campers and staff. Just like communicable diseases, I know it was mentioned earlier today, if you had a norovirus outbreak at your camp, there's the need to have a written plan ahead of time, and that's that prevention piece. So there's considerations looking at, there's the chance that there's going to be multiple kids sick at one time. So looking at your space, and that's going to be unique to each camp premise or each campsite. And then also, it was kind of brought up right before this, considering where your campers are coming from, because that length of time that it takes parents to come pick up the kids is going to vary, again, unique to each camp. Then looking at the green box, this is kind of an encouragement or a case for camp. This moves away from the regulations specifically, but it shares a story from Wisconsin camps that did operate in 2020. And so camps that extended beyond their existing consulting physician, some formed medical advisory boards, some had contacts with additional medical professionals that were closer to the pandemic, and that could help further their planning and preparations for successful, 2020 to go ahead and decide to operate. So the code does have staff supervision ratios. And so I wanted to include a simple to read table to show you kind of what that ratio requirement is at.
Stephanie, unfortunately, it has cut out again. Maybe if we do the presentation without the slides, then we can hear. So maybe if you stop casting the video and just do the verbal part, then we can, because it freezes up. So we've been losing you.
Oh, sorry. Hold on, let me turn off my video because it might save some bandwidth. Hold on just 1 second. If I stop sharing, I can turn off my video. Okay. Do you want me to just try it one more time with the current slides and see if it's still lagging?
Yes, that's fine.
Okay. And you can just stop me or interrupt me if it's still lagging. So is it at the slide that you can see the supervision ratios?
Yes.
Okay, perfect. Okay, so then now I want to kind of jump from the actual what regulation says about camp and COVID and go into some frequently asked questions that our department has received. So now the slide should show kind of like a map of Wisconsin. And the question was, do camps require a COVID-19 test before arrival? Well, the answer to that is there's many resources to answer this question. Parents are empowered to help screen their campers at home pre-camp. That's just one of those mitigation strategies that the field guide that ACA has helped collaborate and produce with that and E consulting firm. That manual, that field guide has a lot of recommendations, and this specific section of the field guide is 13.0 that talks about screening and testing. That's a great place to get additional detailed information. The Department of Wisconsin's Department of Health Services COVID-19 website has these links that I placed onto this slide. So in addition to the parents screening campers at home, there's also community testing sites, and you can see by the map they're widely available throughout Wisconsin as one option. There's at-home test kits that are also available throughout Wisconsin. And so the staggered drop-off idea is, excuse me, my youngest coworker here just is walking into the room. No, thank you. So the key thing is the families should basically screen out anyone who is sick from ever being admitted onto camp. So if there's a fever over 100.4, that would be like screened at that drop off, right? Because there's this ongoing pre-screening and arrival questionnaire and temperature. Oh, and the last plug, and I'm not connected with CampDoc, but I do want to also share that camps have this ability to lean into their technology. So the CampDoc is one of the 9 approved healthcare software vendors in the state. And so that platform can also be integrated with all these pre-screening tools and pre-screening information to support you in connecting all this health data. What about PPE, protective equipment for health center staff? The answer to that question is not going to be found in the rule, but we do have best practices available through the American Camp Association and CDC. All of these links and resources can be found. I know I kind of sent them ahead to Sydney and Pernicia, so you can look at them as needed later on. And it's also covered in section 10.0 of the field guide. So a camp wants to open in 2021 at full capacity. Is there anything stopping them? I think we've gotten this question. The first response would be to check with your local health department. If there's any everything, starts very local. If there's any restrictions, that would be a great first place to start. And then it kind of goes back to a few slides ago. What is your specific camp's ability for isolation, for quarantine? What kind of space do you have available? What kind of staffing coverage do you have the ability to fulfill? And this case for camp talks about the length of a longer session. Many camps in 2020 offered longer sessions, 2 or more weeks, even 4 to 6 weeks at a time in an overnight setting. And that the staff and the campers to create a bubble where all of the staff and the campers agreed and had buy-in from the start to stay within that camp premise. And so it really created this added layer of not interacting with the public and possibly introducing COVID-19, on a daily basis. So that was one encouragement or from a case from other camps in Wisconsin that had operated. How's the slides keeping up?
Yep, we're good. We can see everything. And then we have about 4 minutes left on this. So if you want to hop to the other 2 that you had highlighted in the presentation.
Yep, I will do that. So this is actually kind of that safety lasagna that was talked about earlier. And I just want to really further explain a little bit more about this. And so these strategies in Wisconsin, we're referring to them as the Swiss cheese. So when held alone, the larger holes are obvious, but if you stack them together, it forms a more solid barrier. And the CDC has the MMWR published that used a Wisconsin example that occurred, an overnight summer camp retreat occurred from July into August. And they only use the pre-arrival quarantine and outdoor programming as only 2 interventions. And they ended up experiencing an outbreak that led to 76% of their attendees with COVID-19. So I have a link for you to see that specific article. Again, podcasts that give you abundant tips. This national news coverage was on a camp up in Hayward. Again, it's not a campus camp, but I think there's still practical tips that can be gleaned from the podcast and from the story. Also, the link to some of the templates that you don't have to recreate the wheel. So taking off your COVID risk hat, I want to jump into some statewide trends in violations and what has been observed. So this slide kind of shows what COVID outbreak or COVID-19 impact has had in 2020. It was about half of the visits to camps, and I think that was mainly because some obviously didn't operate, or some had campers and some did not. So if we look at the trends, starting at the base, there were not maybe effective screens in the cabins. You can see, I think, the bar graph here. But there's a pattern, I guess the main point is that there's this pattern of repetition, and you can see in blue in 2020 and then in blue font for the years past that these same violations seem to be repeated. And so these trends are a driving force of code revision. And so changing technology with the medication logs, medication administration logs, I think the changes that we will see coming in the code revision will help address some of these repetitive trends in observations, especially when it comes to these top ones of the medication log violations. So if you have not been involved in code revision, I know I'm right down to the end of my time, so I just wanted to quick plug this. If you have not been involved in code revision, there is still a lot that you can do to be involved. The virtual industry advisory team has been an absolute gift, and they have been meeting on a routine basis. If you take a look here at our timeline, the target for public hearing is this fall. So there is plenty of opportunity for you to provide input. If you want something updated in the rule, then right now is really your open window of opportunity. I have here the recognition of all of our advisory members who are from the different sectors in the industry. And so definitely thank them for helping shape the regulations, and stay connected. If you have a suggestion, email me, text me, or give me a call at the number here on the screen. And know that in addition to code revision, things like educational materials to also help empower industry and empower regulators to understand why behind the common violations to help improve and to help keep kids safe at camp are also in the planning phase. Okay, how did I do on time, Pernisha?
You're good. Thank you very much. You were the final presentation of the day, and now we get to do the work. So thank you very much.